Today on EMN5, we're going to talk about croup. And croup, thank goodness, is the short name for laryngotracheitis or laryngotracheobronchitis, which is basically edema of the airway and larynx. And croup, just like a lot of URIs, is caused by viruses. Parainfluenza virus being the predominant one, but it can also be influenza, RSV, adenovirus, coronavirus, rhinovirus, just like URIs. It can be bacterial. If it's primary, it tends to be mycoplasma, whereas if it's secondary, in other words, if it's a virus first and then has a secondary bacterial infection, it tends to be strep pneumo, staph aureus, or strep pyogenes. As far as who tends to get it, it's kids. Little kids get croup. 6 months old to about 3 years, and we see this all the time in the winter and typically at nighttime. In fact, most ER visits are documented as being between 10 p.m. and 4 a.m. Kind of interesting. And the classic symptom for croup is this seal-like barking cough. So in general, parents will tell you that the kids have been having URI symptoms recently, congestion, some cough, and now they're having to have this seal-like barking harsh cough. It might even have some hoarseness or stridor, and at later stages, even some respiratory distress. Now, adults can get croup too, but why do kids tend to have this barking cough, whereas adults just maybe have a little bit of fullness feeling to their throat or neck? And that's because of this well-known difference between the pediatric and adult airways. Kids tend to have this very narrow subglottic airway, especially compared to adults, and you can imagine if this has some edema, it's really going to get quite narrow and causes that stridor and this barking cough that's much louder and more significant in the kids. Now, this is a video that a mom posted of her daughter with this barking cough. It's a great video on YouTube. So here you can see there's that stridor, actually inspiratory and expiratory stridor. You can see some retractions down here, pretty noticeable. And there's also some tracheal tugging you can see right here. And there's that very classic barking, croupy cough. So thanks to that awesome mom who posted those classic symptoms. Now what about imaging? You can get PA neck films which show some of that narrowing. So here you can see this lucency, that's the trachea. And up here at the top we see that it's narrowing. This is soft tissue edema along the walls. And this is known as the steeple sign. And that's pathognomonic for croup, but mostly it's a clinical diagnosis. As far as treatment for croup, number one, you want to make the patients comfortable. We don't want to make their breathing any worse than it already is. Put them in dad's lap in a quiet room, make them comfortable. Now next, we tend to give kids this cool mist or humidified oxygen. However, it's actually been not shown to be that useful in studies, but there is a lot of anecdotal evidence, so sometimes we see it used fairly often despite the lack of evidence. And this leads us into what we can kind of tell parents as far as treating the symptoms at home. They can try cool mist if they feel like it's helpful. Again, not a lot of evidence. But one other thing we see is that the actual cool air helps a lot. So right before the kids are brought into the ER in the middle of winter, parents say that they have actually improved during the car ride to the ER. So you can tell parents, try having them go outside, take them for a car ride, have them sit by an open window or door. And the other thing is just helping their breathing by having them sit up a little bit more. So you can have them sleep in a car seat, for example, or kind of propped up on some pillows. Now, as far as treatments in the ER, we have two other great things at our disposal. One is dexamethasone, so a steroid. You can do this, PO is preferable, just because it decreases agitation, and this will reduce the duration and severity of that swelling and the cough. And then we have racemic epinephrine. The key here is that the duration of this drug is about 2 hours. So you need to observe the patient for at least 3 to 4 hours if you give rac epi for any rebound symptoms. Now, there's a couple classifications of severity of the croup, and here's my takeaway from all of this. In mild exacerbation, you have no stridor at rest. So maybe if they're crying or coughing, they might have a little bit of stridor, but at rest, they should have no stridor. At moderate, you are going to have stridor. A severe exacerbation, you start seeing some of those signs of work of breathing. So they're going to have stridor, but also some retractions, maybe a little bit agitated and a little bit more distressed. And then finally, impending respiratory failure, this is where they're not oxygenating well and may even have alterations in consciousness. So keep that in mind. Mild, no stridor. Moderate, you start having stridor. And severe, you should have some increased work of breathing. So that's your basic classification. And that'll also determine what our treatment's going to be. So here's the treatments we talked about. All of these top ones, making the patient comfortable, giving them steroids, this goes for all croup patients, whether mild, moderate, severe. Now, if they're having any stridor, any agitation, any respiratory distress, basically anything that's moderate to severe, you should give rack epi. Now, as far as disposition, basically any in this mild group that's gotten the dexamethasone, those can be observed and go home. As far as the kids who have gotten rack epi, observe them more than 2 hours, probably 3 to 4. And if they've improved and they're not having any rebound symptoms, they can go home too. Now, what if they have rebound? You can try retreating them and watch them again. But if they keep having symptoms despite rack epi, you probably need to be admitting those patients for observation. So 3 to remember for croup, it's laryngotracheitis caused by the parainfluenza virus predominantly. It tends to cause this barky, seal-like cough. You might have stridor, and the PA x-ray, you'll see the steeple sign. And lastly, treatment is dexamethasone and rack epi if you start hearing stridor. Make sure you observe them for about 3 to 4 hours if you give rack epi for rebound symptoms. Here's the references, and thanks for joining us at EM in 5.